We're continuing to follow some breaking news out of Northwest Omaha right now. Very touchy situation. For more than 2 hours, authorities tell us a man has been stuck in a trench. He was working on a private sewer line or sewer area over there in a private neighborhood residential home. And we actually have our medical expert, Dr. Bruce Buehler. He was supposed to be talking about something else, but obviously you're the one who knows. We were talking during the commercial break. I don't think I realized kind of he's down 8 to 10 feet in that frozen ground, how severe the situation is for hypothermia.
About twice as severe as the weather. So we think of, it's 25 or whatever degrees out, but down in there, it's well below zero.
Yeah.
That's actually frozen ground. So he is getting frostbite, and he is actually dropping his heart rate rather quickly. And at this point, he's having a hard time getting enough blood to his ankles, arms, and so on. So we have to get him out for the simple reason that he's essentially going to get frostbite and possibly, in this case, slow his heart rate so down. So the oxygen is trying to make sure the little blood he has going out is purely full of oxygen.
And he's, as authorities last briefed us, he was awake, he was alert, he was talking, he's able to communicate. He's a little panicked right now, as you would be in any situation, but like you were saying, he's getting oxygen, which is good for him, which he needs right now. How long does he have to get this oxygen for, or how long will it kind of help him until kind of the hypothermia overtakes, the process?
The oxygen will help him continuously. The big problem in this case is if he were not conscious, it would be very difficult.
Okay.
The fact that he's conscious and panicked, and to be very honest, that means he's pumping much better than he should.
Okay, well that's good news to hear.
It's what's called fright and flight, and your body says, I'm in trouble, and it runs up his heart rate. So he's actually protecting himself by being a little panicked. I know you want to, not frighten him and all, but he's helping himself.
It's a good point you made. And also, so everyone has to be very quiet on the scene right now, so they're able to communicate with this man stuck, as I mentioned before, about 8 to 10 feet down in this trench. Let's talk about so it sounds like right now mostly his legs and his feet are trapped. As we see, they're bringing the shovels in there. It's a very slow process. How important is it that more dirt doesn't fall on top of him, especially in the leg area, those arteries and all of that?
I think any dirt on him is going to be horrible because, again, it's going to lower his blood pressure, his blood temp, and so on. So the big issue now is to keep the walls from falling in and slowly bringing his legs out. He can't feel them.
Yeah.
So if they ask him, are we hurting you or anything, he won't know.
He won't know.
So they have to be very cautious. They have to go, and truthfully, I don't think they can do a trench digger or anything down in that area. They're going to have to shovel and go very slowly, and at a certain point, they're going to have to do hands. Once he's out, the big issue now is how to warm him up. If you warm him up too fast, then you get in trouble. So you have to bring him back very slowly. You have to hydrate him, and you have to make sure that his blood pressure and all stays up. And this is going to be a very quick emergent decision as soon as they've got him out.
Very insightful. Thank you for joining us today, Dr. Bruce Buehler. That was very helpful. Again,